My name is Bailey Stanton of Stanton Equine Veterinary Services, a mobile equine veterinary practice that travels around the province of Alberta. This is Cessna, a horse of mine, and today she is going to be a part of the first online video that we're going to post. Hopefully these videos will become a consistent thing that we do every few weeks and kind of allow you to start learning about some different veterinary practices that I perform as well as other veterinarians do. Today we're going to start with a physical exam, the most basic fundamental veterinary exam that we perform. The physical exam varies depending on the case and the history of the horse and what we're specifically worried about, but there are some very consistent parts of the exam and we're going to go through most of those today. The physical exam is an exam that you should have performed at least yearly in order to determine if there's anything going on with your horse you're unaware of and help prevent any issues you might have. Our recommendation is to at least have this exam done prior to the season, and it is included in the pre-season packages that you guys will see posted soon and will be made available. So the first part of the exam is basically a distance exam, or that's what I call it, which is where you stand back and you look at the horse at a whole. Things that I'll be looking at are the weight of the horse, or a body condition score, what the hair coat looks like, how the horse is muscled, the way the horse is standing, is it looking comfortable or does it look painful and uncomfortable? The general demeanor of the horse, so are they bright, alert, responsive, or do they look dull or depressed? And then we start looking more specifically at each aspect of the horse. Depends a lot on the veterinarian, but where I start is at the head. Makes sense to me to kind of go top to bottom, but I do bounce around a little bit. So I look at things, first of all, like their eyeballs. If there's anything suspicious with their eyes, or the owners are curious about something or worried about something to do with the eyes, we'll do a more thorough exam with an ophthalmoscope as well as a light to make sure their pupils are reactive and all of their reflexes are normal, as well as the chambers of the eyes look normal. If it's not a big concern, usually we kind of just take a really good look at them and make sure there's nothing abnormal. The ears are another thing we look at. Make sure that they're not droopy or look like there's any issues or wounds or anything associated with the ears. Usually, once again, the owner has history that directs us there if we need to be more specific. Looking at the symmetry of the muscles on the horse's head, any other abnormalities down their face. If respiratory disease is a concern, sometimes it's called percuss their sinuses to make sure that they sound normal. And then, of course, looking at their nose to make sure there's no nasal discharge or anything going on there. Often we'll take a peek in their mouth. We can try to determine if they need their teeth done just by peeking in there, but a dental float or at least an exam is also recommended yearly, especially in our performance horses. Another thing that goes along with the evaluation of their head is their mucous membranes. So in most horses, they're pretty good about us just quickly picking up their lip, pushing on their mucosa, and seeing how long that pink takes to go away. And that helps us indicate how hydrated they are. We also feel, usually with an ungloved hand, if they're moist or tacky, and just the color of their gums can give us an indication if they might have some sort of illness going on. So the next part of the exam that I typically do is listen to the heart. So when I listen to the heart, I'm listening for abnormal sounds, which might indicate that there's a murmur, or an abnormal rhythm. So sometimes I'll listen for quite a long time because it takes a while and it's challenging to hear some of these things. While I'm listening, I'll also take the heart rate. So I'll calculate, usually I count for 15 seconds and then multiply it by 4. And as well, when I'm standing here just listening to the heart for a while, I'll often take the respiratory rate as well, just by watching their thorax expand and contract. The examination is to listen to their lungs, and for me, I listen to their lungs as well as kind of reevaluate the respiratory tract heading towards their head. So I start by listening to their lungs, and the lung field, depending on the horse, is really large. I kind of outlined it in general there. So we'll listen in different spots all along the lung field. We're listening for any crackles, wheezes, harsh lung sounds, which would indicate that there might be some inflammation in there. And just listening for any abnormalities that might stand out to us. After I listen to the lungs, I usually actually jump back up to their neck because I then listen to their trachea, which is their windpipe. So I'll take my stethoscope and go all the way up their neck and listen as they breathe and make sure that there aren't any abnormal sounds there. I usually kind of go back to their throat too if we're worried about respiratory issues, and I'll kind of squeeze their throat and see if I can elicit a cough, because some horses that are very irritated will cough. And then another thing I look at in this area is their lymph nodes, which hers are normal now and she's pretty hairy, but sometimes horses will have swellings here that indicate that they have some inflamed lymph nodes. So after I listen to their lungs, I either do both sides of their lungs first, or sometimes I just do one side and then I immediately, while I'm on this side, listen to their guts. Oh, Cessna. All right. So to listen to their guts, I'm listening to 4 quadrants. I'm listening to the dorsal quadrant on either side and the more ventral quadrant on either side. Horses' gut sounds should be fairly active, but there is such a thing as them being too motile or too active. So we're listening for lots of gargling sounds, and with experience of listening to lots of guts, you start to realize what might be abnormal. Another really important part of our exam is obviously taking their temperature, even if they don't seem like they might actually be sick or anything. Sometimes we can have some surprises when we actually do take their temperature. So I just use a digital thermometer, but you can use a mercury one too. And while we're back here, we usually take a look at some reproductive organs as well and make sure everything looks good there. Their normal temperature should be between 37.5 and 38.5. However, on days like today when it's super cold, having a horse at 38.5 or creeping up towards that would be concerning for me. So if you're unsure, ask your veterinarian about the right temperatures and what would be acceptable. So while I'm doing most of this exam, I'm evaluating everything in between all the different points that I'm looking at. A good example of this is while I head towards doing the final part of the exam, which is feeling the digital pulses, I usually look down the legs and make sure there's nothing standing out to me in their joints or anything to do with their foot. And then I come down here and I feel a bundle of vessels that's just kind of at the back of the fetlock on either side, feeling with my 2 fingers, pushing gently, and determine if the pulses might be bounding, which would mean they're stronger than they should be, indicating some inflammation in the lower limb. In a normal horse, typically they're really hard to feel until you're experienced at it, so that lets us know that they're probably fine if they're really hard to feel. So that was a general overview of the physical exam that I perform. Definitely varies vet to vet, but those are kind of the things that we all typically look at. Depending on what's going on with the case or with the horse, we might do a more thorough exam into each aspect of those things we looked at. For example, doing a lameness exam where we more thoroughly evaluate the legs for soundness, or an ocular exam or a neurologic exam. We also may start performing some diagnostics depending on what's going on with the horse in order to figure out a diagnosis and then pursue treatment. So that's all for today's video. We're definitely open to requests for any other topics that people might want some more information on, and we hope to see you back next time.